Today we are really happy to have Tony Montgomery. Tony's with Assured Partners, and we've had the privilege of having Tony share some thoughts before. So today we're calling this one Medicare 101. And Tony, our hope is that you can help us understand this very complex medical insurance option that's out there for those of us that are a little older and for those that maybe have other circumstances that would put them in need of that. So Tony, I guess we're going to start with just kind of the basic question. What is Medicare?
Well, thanks, Wendy. Thanks for having me, and I'll do my best to make it as simple as possible. Medicare is basically a federal plan for health insurance that's available to all people in the country that reach certain guidelines, certain standards as far as qualifications go to have Medicare. Most common of which is when people turn 65. Most people that go on Medicare, this is the reason that most will enter it, is because they're approaching that age where they start getting all kinds of mail and the TV ads and the phone calls that arrive trying to explain to them and trying to offer them Medicare plans. Essentially, Medicare is designed for people who turn 65. They would be eligible for Medicare the first of the month in which they turn 65. Some people get a little confused by that. They say, well, I don't turn 65 until the 25th of May. That's okay. They're eligible for Medicare the 1st of May. People don't understand they can actually have Medicare for 3 weeks before they even turn 65. If they happen to turn 65 on the 1st of the month, they're eligible for Medicare on the 1st of the month before. So they actually would have a whole month worth of Medicare before they turn 65. There are some other reasons, however, why people can be eligible for Medicare with not turning 65. Those would be for the people who have been on Social Security disability income for 24 months. If you've been receiving SSDI for 24 months, you are eligible for the same Medicare that those who turn 65 are. For people that have Lou Gehrig's disease or ALS, they're immediately eligible to go into Medicare, as well as those people that have end-stage renal disease or kidney failure. They're also eligible for Medicare. So it's not just for people who are older, but that is certainly a majority of the people who do enroll.
Okay. So then when it comes to those health issues, does the family physician let you know that's an option, or how do people find out about that?
Well, basically, the way the market is set up and the way the government will work is usually by the time you reach 64 and a half, you start getting information from Social Security regarding your Medicare eligibility. Also, there's a lot of companies out there that are trying to ply you with advertisements and programs and solutions. The mail starts to arrive from those companies as well. People have certainly a pretty good idea that Medicare is around the corner just by the amount of mail they start to receive. Okay?
True. And I guess my laughter would imply that perhaps I've already crossed that bridge.
And I've been in plenty of homes and I see the pile of mail that comes. And unfortunately, no matter what you do, you're on a list and you cannot come off of it. You'll always get the rest of that mail.
And it's kind of comical too if they got the wrong year and you start getting that at age, let's say 25. That's kind of a comical moment.
Get used to it.
Yeah, exactly. Well, now, and having walked through this, there are so many things that come at you. There's different plans. And I understand that they tried to simplify this by putting letters next to them. So can you kind of walk us through?
Certainly. Medicare is designed to have parts to it or sections to it that people are able to enroll into depending on their needs. The basic part of Medicare, what we call traditional Medicare, has what we call Medicare's Part A and Medicare Part B. Now, Medicare Part A is called hospital insurance. This is the part of Medicare that will cover you if you were to be admitted into a hospital. It's the part that covers your room, your food, your nurses, your medications if you get admitted. It also covers if you need skilled care, if you need rehab after a hospital stay. It's also the part of Medicare that covers hospice care. Now, Medicare Part A has no monthly premium. I have a lot of people that tell me, well, your Medicare, that's the free part of Medicare. No, it's not free. As long as you worked at least 10 years or 40 quarters where you've paid into the Medicare system, you've earned your Medicare Part A. So although it's not free, And nor do you pay anything extra for it. You've already paid ahead for it quite a bit. Now, Medicare Part A, if you were to be admitted, has no co-payments for the hospital stay. Rather, there's a deductible that you are to have to pay. And that deductible could be multiple times per calendar year, up to 5, based upon how many times that you get admitted throughout the year.
Okay.
The skilled care, the rehab you get after a hospital stay, Medicare gives you the first 20 days of that rehab for free. If you need more than 20 days and you're eligible for it, you will have a copay per day up to days 21 to 100. Okay?
Yeah. Now, let me ask you this, though. On that Part A, you mentioned the 10 years, the quarters. That would be something then somebody needs to pay attention to, their work history. Correct?
Correct. Yeah. For those who have not worked 10 years, to achieve the 40 quarters, if they have a spouse that has, they're eligible for the Medicare due to the spouse's work history. For those who have not worked 40 quarters and have not received the eligibility for the no-cost Medicare Part A, there will be a monthly cost associated with it, prorated to how many months they actually did work.
Okay. And then is that a bill? Is that something they receive a bill for?
Right. They would receive a bill for the Medicare Part A. It's not often that happens, but it could happen for people who have just started working not that long ago.
Okay. And then as far as how does this work? Most of our healthcare facilities would be able to give them, they would be having guidance on, hey, you have so much coverage. If you're getting close to running out of coverage, let's say you're in the hospital, do they notify you and say, hey, you're getting ready to be self-pay? How's that work?
Unfortunately, they're not as courteous about that. A lot of times they'll tell you when it's a day away, hey, you've run out of your time that you have to start paying, or it's free. I've had a lot of cases where people have called and said, well, I've exhausted my 20 days. Now what do I do?
Now what do I do? Okay.
More often than not, they've already had some sort of insurance to address that concern. But I've seen people scrambling at last minute to try to find themselves an alternative to their skilled care stay.
So it's just another good reason for why we want to make sure we understand the plans, and then we can kind of plan and prepare ourselves for what's the next step. Right. So then we have, so that was the Part A piece.
That's the Part
now
A,
there's
hospital.
Part B. So let's talk about that.
Part B is the other half of traditional Medicare, probably the half that does most of the work, that we use the most. Part B is called medical insurance. Now, Medicare Part A is called hospital. Part B is called medical. When you eventually have both, they go on the same little red, white, and blue Medicare card. Gotcha. Medicare Part B is the part that covers all of the doctors, whether it be family doctors or specialists, surgeons, anesthesiologists, any kind of doctor that you see would be covered under the Medicare Part B. Medicare Part B covers the outpatient care, the day surgeries, the overnight for observations, the emergency room stuff.
Okay.
Medicare Part B covers any tests that you get, blood tests, urine tests, CAT scans, x-rays, MRIs, colonoscopies, things such as that. It covers the durable medical equipment, the devices or care and equipment that you need through your medical needs, such as diabetic test strips, monitors, CPAP machines, canes, walkers, wheelchairs, hover-rounds. Things such as that are covered under Medicare Part B. Blood if you need a transfusion, and injectable medications, drugs that we can't give to ourselves, such as chemotherapy, dialysis, drugs that need to be provided to us by a doctor or hospital. Now, Medicare Part B has its own rules and how it covers things. Medicare Part B does have a monthly premium. The base amount that most people pay across the country for Medicare Part B this year is $170.10 a month. There are some reasons why people will pay more for the Medicare Part B. One being if they neglected to have credible insurance and delayed their enrollment into Medicare Part B more than 63 days, Medicare Part B will impose a late enrollment penalty, which is 10% extra for every year. There's also what's called an income-related monthly adjustment amount. It's for people who have higher incomes. Medicare will look out to the IRS, they'll seek out information from them, and based upon your household size and income, they could charge you more for the Medicare Part B based upon what your tax returns have been. So they're the two reasons that that Part B premium could be more.
Okay. And they set that number from, like, for instance, in 2022, they were looking at 2019's return, correct?
It would be 2020. So
I'm sorry, 2 years, correct. So 2022.
Correct.
So setting the premium for 2023 will be last year's return.
Correct.
Correct. Okay. And for that piece, Tony, what if you would have a one-time item, i.e., you sell your home and there was capital gains, or you sold an investment and there was capital gains, and it kind of bumped your tax return up? How do they handle that?
Well, yes. Every year, the IRS, Social Security, and Medicare all talk to each other. So every year, Medicare will seek out that information from the IRS to see what your tax returns had been for about 2 years prior. Now, if you have a capital gain, that will reflect on your tax return. Medicare will say, oh, you made more money this year. We will raise your Medicare Part B premium accordingly because of what you made that year. Now, what happens organically is every November 1st, Medicare will again reach out to the IRS and see what was the next year's taxes, and they will adjust it higher or lower based upon that information. Now, Medicare does have the ability, they provide you the ability that you can appeal that decision, meaning since they're looking back almost 2 years in some cases, what if you've retired and the income they're looking at was when you were working full-time job? Well, the following year after you retire, you can say, well, I don't make that much money. Medicare does not know that, nor will they know that until those 2 years are up, so you can appeal. And you appeal to Social Security and you say, well, this is the income I have now, that W-2 income or that 1040 income that I had previously, I no longer have it. Medicare will say, fine, we did not know that. We'll adjust your monthly premium for the Part B accordingly now. If it turns out that you weren't truthful in your statement, you will be penalized for that.
Okay. So then, and that is a question we get quite often, that we want to know, how does my income tax return? And there's a modified adjusted, and there's things that go into that number. But it's very important to just at least have that on your radar to understand, hey, your tax return can impact your premium. So now that we understand that, what would be triggering events, Tony, that, because I know you're coming into your busy season. So we know our accountants go into their busy season in the beginning of the year. You're going into your busy season because we have a time frame to get into these plans. What's our time frame?
This time of year coming up, it's called the annual enrollment period for Medicare. It goes from October 15th to December 7th every year. This is the window where people that are already in Medicare plans can look to make changes or adjustments to the plans they have. So as such, people already in Medicare will be bombarded with the TV ads and with the phone calls and with the mail, and it raises a lot of questions. We get a lot of phone calls. I have a lot of appointments, people looking just to see if what they got for insurance 3 years ago is still appropriate for them. They look to change their Medicare supplements and drug plans, or they look to change their Medicare Advantage plans in this window. That's why it gets so busy. Now, for the most part, Medicare and associated plans have been pretty similar for quite a long time. Fact in Medicare is, if you like the insurance that you currently have and it works for you, if you do nothing, everything automatically will re-enroll itself January 1st. Now, people not yet in Medicare completely, meaning Part A and Part B as their primary insurance, this window means nothing. They're not in full Medicare until they have Medicare A and B as their primary insurance. Some people feel that, well, this is the time of year I sign up for my Medicare in the first place. That's not the case. So there's a lot of these. There are a lot of the times I have to explain to people, well, not yet, not this time for you. Now, as far as you asked the question, what if I'm still working? Medicare does have a late enrollment penalty if you get the Medicare Part B late. However, they do not charge that penalty if it's found out that you have credible insurance instead, i.e., insurance to an employer with 20 or more employees. That is considered credible health insurance in Medicare's eyes, and if you have that instead of your Medicare, they will not charge you a penalty. Many of the phone calls I get from our group health clients revolve around the fact, well, I was told that I'm turning 65. I must do something. I have to register. I have to enroll. The truth is, you do not have to do anything. If you are already on an employer group plan and your intent is to stay on that group plan, there's no need for you to get Medicare A and B at all.
Okay, so that leads us right into my next question. How do we figure out these supplement plans?
Well, Medicare doesn't necessarily explain these as well as I think they could. And the people that are pushing 65 know what I'm talking about when they will get mail from just about any company out there that's trying to sell them insurance. There's probably nationwide over 100 different companies that are trying to offer insurance to go along with Medicare. It gets very confusing. We know the names of a lot of them, some of the names we never even heard of before. But to make it as easy as I can to explain what the people have for options to go along with Medicare A and B is that Medicare regulates all of those companies. No matter who they are, Medicare tells these companies what they're allowed to offer. And as such, Medicare only permits 2 different kinds of insurance to go along with Medicare, period. People only have 2 options with Medicare insurance plans. I mean, frankly, how many different ways is there to cover 20%? A lot of people don't realize there's only 2, but that's all they have. The 2 choices people have to get insurance to cover those portions that Medicare Part A and Part B does not, to cover the prescription drugs, to cover the dental, vision, hearing, are these. Number 1, Medicare A and B would remain your primary or first insurance. It would be the insurance that doctors or hospitals would deal with to get things approved and covered when you get work done. And then you buy something called a Medicare supplement, also referred to as a Medigap plan. As the names imply, its job is to be secondary behind your Medicare's Part A and Part B. It goes second. So what happens here is your Medicare Part A and Part B is your primary insurance. It's who the doctors and hospitals deal with to get things approved and covered. When Medicare is done paying their portion, Medicare will remit the remainder of the bill to whomever you've picked for your Medicare supplement. And depending on the plan type of supplement you bought, their job is to pay the remainder of the balance. Medicare supplement plans are further divided into plan types. We already have Medicare Part A and Part B. Now we have supplements Plan A to Plan N, of which we would pick one of those letters. Okay. There used to be an F and a C plan before, but they were ceased 2 Januaries ago. Okay. But based upon the type of plan type you have, you may have all of your bills covered completely that A and B doesn't, except for the Part B deductible, which would be the first $233 one time a year. Okay. Now with this, it still doesn't address your needs for dental and vision, for the routine dental and vision. So what do you do for that? There are many dental vision plans that are for the individual market that you can get. It would be outside of the realm of Medicare for the most part. Okay. What I tell many of my people who are coming off employer-sponsored group health insurance is if you have dental vision through your employer now on a group platform, look to see what the rate would be if you were to remain on that via COBRA. Okay. They're entitled to stay on it for the COBRA up to 18 months. Generally speaking, the rate that they would have for dental vision through COBRA is less expensive than if they were to get it individually through a person like me. Okay. More importantly, the Medicare A and B doesn't cover prescription drugs. So in this case, what do we people do for that? Well, we help them find a Medicare Part D plan. Here's the D. We've already discussed the Part A and the Part B, which would be the primary insurance, a Medicare supplement that would be secondary. Now we find a Part D drug plan whose whole purpose is to cover the prescription meds, period. Okay. Now there are 25 different Part D drug plans in our state alone this year. Oh, wow. Right. So what is it that we do to find the proper one? These plans range in monthly premium anywhere from $7.20 a month, clean up to $130 a month based upon your specific drug needs. So what we do and what I do is I use Medicare's website, which is medicare.gov. Using that website, I input your zip code, a complete list of your medications, the name of the drug, the dosage you take, how many times a day you take it, what pharmacy you like. And this will issue a report that will compare all 25 drug plans and rank them in order as to which Part D drug plans would be the most cost efficient for this year. Now, every year going forward, your list of drugs may change. You may have drugs added, drugs subtracted. A brand name drug that you currently take may go generic and your needs might be less. Every fall, this October 15th to December 7th annual enrollment period, we can look to review your drug plan. A lot of times people, they leave their Medicare Part A and Part B alone, they leave their Supplement B, but they ask for my help saying, this is my new list of medications. Is there a better drug plan for me for this year? And I'll be more than happy to give that report to them. Now, Medicare Part D drug plans are never allowed to ask health questions. So as you go along, if we figure out there might be a better Part D drug plan for you, it's easy to change your plan from one to another as your needs change. But that's the first option you have in Medicare.
So if you had those by now, you should have been notified and you need to make some change.
Well, if you had a Medicare Supplement Plan C or Medicare Supplement Plan F with any carrier, starting 2 Januaries ago, if you're new to Medicare, you can no longer get it, but those who already had it were grandfathered in.
I got you.
And they could remain on the plan. Okay. Part of what impacts the monthly premiums for Medicare supplements is not how often you use it as an individual. Rather, your rates are based upon community-based rating, which means all of the people in your demographic group, if there's high health claims, your insurance company can change your rates based upon that. Therefore, if you're in a supplement plan F or plan C that is no longer available to the newer, younger, healthier 65, 66-year-old people looking to join your demographic, well, then the average age of that plan F or plan C that you have is getting older. As they get older, generally there's more claims, and that sometimes will make the rates go higher than what other plan types would be. You can look to change your supplement to get something that's more affordable, or maybe something that is more in line with what people can get now. The problem with that is Medicare supplements do require health underwriting questions if you're not new to Medicare. And so it's quite possible that you may not be able or eligible to get a supplement with somebody else.
You might need to stick with it.
You might have to.
Okay, okay. So then on these plans, let's talk about the Meta Advantage plans.
Okay.
Versus a Meta, I think I'm saying this correctly,
Medicare Advantage plans, or Medicare Part C.
Correct. Okay, let's talk through
that. That is the second option people have when they enroll in Medicare's Part A and Part B. In this situation, Medicare Advantage plans are not Medicare supplements. They do not go secondary behind the Medicare A and B. Okay. Rather, what they do is they become your primary insurance. Okay. They are the insurance that you will use when you deal with doctors and hospitals and so forth. Mm-hmm. Now, in order to be eligible to get a Medicare Part C Advantage plan, you must have Medicare's Part A and Part B, which means you still have to pay the $170.10 a month. Mm-hmm. Normally, it's deducted right off your Social Security check if you're collecting one, but you still must have the A and the B. Okay. Now, what happens is when the Medicare Advantage plan kicks in, they notify Medicare, we've got this enrollee now, we'll be primary insurance. Okay. Medicare A and B, you're off the hook. So now the Advantage plan has taken place as the primary insurance. Now, a lot of times these Advantage plans will advertise no monthly premium or very little monthly premium. We see that all the time. Correct. I often tell my people, how in the world can you get health insurance that doesn't cost you anything? Right. Well, basically, you can't. What happens is Medicare looks at what they would figure their average costs would be to insure people that have Medicare A and B as primary. And then when an Advantage plan steps in, Medicare rates all of the Advantage plans, no matter who they are, anywhere from 1 to 5 stars based upon how well they perform, how well they provide health care to the enrollees who have it. And as such, the higher the rating that a Medicare Advantage plan might receive will determine how much Medicare would pay them to cover an individual, so that way Medicare is off the hook. There's still a lot of people who will get these plans. Half of my people are on Medicare Advantage plans. Why would people do that knowing this is how they work? What are the advantages? How do they get its name Advantage plans? All of these companies, no matter who they are, who these Advantage plans are, their job is to give you tools to keep you healthy, because the healthier you stay, the less you have to use their insurance down the road. So the tools they give you, your Part D drug plan, your prescription drugs in most cases will be covered under these Advantage plans. Most of these plans give you, and depending on the company, better or worse, dental, vision, hearing coverage that you don't get with Medicare. It will cover routine preventative care. All of your preventative services will be covered because they understand that they catch an issue early on, you'll be cheaper to fix you up if they find a problem. They offer you free wellness programs that if you choose to participate are designed to keep you healthy, because they know the healthier you stay, the less expensive you're going to cost them in the long run. Many of these plans offer free gym membership programs. Okay. Traditionally, we hear the term silver sneakers. They will offer you free gym membership because they know if you go to a gym and do something, you should be healthy if you didn't, and save them money in the long run. These plans, in most cases, have no annual deductible at all. Nowadays, a lot of these plans will give you over-the-counter benefits. They'll give you an allotment each month or every 3 months where you can buy headache pills and Band-Aids and vitamins, things to keep you healthy. And these plans are required to give you emergency care worldwide.
Okay.
Now, that's the positive. That's the benefits of Advantage plans.
I was going to say, it sounds too good to be true, Tony.
Well,
so what's the catch?
With pros do come cons. What are we giving up by leaving Medicare and a supplement to go in an Advantage plan? Well, unlike Medicare and a supplement, which has no network, so to speak, Medicare Advantage plans do, where they're going to be called either PPOs, HMOs, private fee-for-service plans, where we have to be careful with the company we pick for the Advantage plan to see that it allows you to go to the doctors and hospitals that you prefer. You'll be in a network very similar to what people have while in group health insurance plans.
Gotcha. Well, it sounds to me like when you get into situations that might be unique to your healthcare situation, it's really good to have an expert kind of walk you through this so you don't miss something. Because that's probably something we hear often is, the one that breaks our heart is when we hear, I can't afford my prescriptions, or it just costs too much to go to the doctor, or those types of things. And it sounds to me like there's choices out there. It's just getting that person in the right place. So can you talk a little bit and, just briefly about this donut hole thing that is we hear about?
As far as the donut hole is concerned, this is an issue that comes up a lot with my clients that have some more costly medications. Whether you get your drug coverage through a Part D drug plan, standalone to go with Medicare A and B and a supplement, or if the drug coverage is embedded in your Part C Advantage plan, there is a thing called donut hole, meaning that once you get to a retail price or total cost of drugs throughout the year of a certain amount of money, your plan will not cover your medications quite as much as they did during the initial phase. There's a window called donut hole, which is officially called coverage gap, where your copayments would or could be higher than what they were originally. Now, there's also an end to the donut hole. Once the donut hole begins, then you're paying a lot more of the cost of your medications. Then when you hit catastrophic phase, then your donut hole is over. And then from that point until the remainder of the year, until the end of the year, you would probably pay less for your medications. Then every January 1, it resets.
So Tony, if you would get that call that, hey, or you just learn that you have a health issue that's going to shift you into needing prescription drugs that are very costly, you can't change the plan mid-year, correct?
You cannot.
You're kind of stuck with what you have. So in fairness then, you don't always want to go cheapest or less costly maybe because of that possibility?
Here's the way prescription drug plans work in the world of Medicare. Yes, you can only change them October 15th to December 7th during the annual enrollment period, with the exception if you or on the state pharmaceutical assistance program, then
okay.
you can make more changes throughout the year. But for the most part, you can change your plan once a year. Now, every drug plan that is available has a formulary. That's the list of drugs that the plan covers. Every drug plan does not have to cover every drug. What they must do is they must cover at least one drug of every therapeutic class. So they have to cover one drug for diabetes, one drug for blood pressure, one drug for whatever the case may be. It could very well be your new drug that you need is not one of those covered medications. Okay, so there will be at least one medication that might be similar, but your doctor has told you, no, you can't take that version. You must take this one I want to give you. There are tools within drug plans, such as appeals, tiering exceptions, but also formulary exceptions where with a letter from the doctor, a form from the doctor, you can ask your drug plan for an exception to add the drug to your plan temporarily for the remainder of the year. They may cover it, may not cover it, great. At least you have some coverage, and then that following fall we can address your full list of drugs to see if there's a new plan that covers it better at the end of the year.
The other plans that are out there, so we talked about A, we talked about B, we talked about C, and then there's the drug plan. Now, is there anything else in those plans that you're like, hey, these are some of the things people might want to consider?
Well, I mean, I'm often asked, what do most of your people take?
Yeah.
And I'd say it's pretty broken down 50-50 if they go with supplements and a Part D drug plan or an Advantage plan. Mentality shifts for people as they get older. Half my people that I see are shifting away from group health insurance plans, retiring off of work. More often than not, they tend to go with Medicare Part C Advantage plans because they most mimic what you've had through your group employer plan, but without a deductible in most cases. Half my people come from retirement communities. Now, these people, their mindset is a little different. They don't have all of the same expenses we may have when we're younger. A lot of times, if they're living in a retirement community, they don't have a mortgage. They don't sometimes have car payments, other things. Their mindset is, well, you know what? If I pay more for my insurance and I don't have to worry about my medical bills, kind of suits their mentality at that point too. So I see it shift at some point as people get older. But I've had people that, I have people now in their 90s or even older who have been in Advantage plans their entire lives and love them because of the money they've saved per month. And their copays, they figure, is a drop in the bucket compared to what they've saved in monthly premiums. I also have people, my youngest client was 23, due to certain illnesses. Now they're going to doctor a whole lot, and they're going to maybe see doctors from all different regions of the country. Well, then for me, in my mind, it makes more sense for them to stay in traditional Medicare and get a supplement that not only covers all of their bills, but also has no network that they have to deal with. As long as the doctors or hospitals, wherever they go, accepts Medicare, they're good to go.
Mm-hmm. Well, man, we said Medicare 101, but obviously I think we've went way past that, and I really appreciate it. I know there's a lot of individuals like you out there that do this sort of work, and our desire would be that you seek out someone that is more rooted in making sure you get the right plan, not sell you something, so that there's no conflict of interest. And that's one of the things I appreciated about you, Tony, is you're all about education and helping people to understand what's out there, and then they can make an informed choice. So I really appreciate that about you. Thank you.
My pleasure.
And if you have questions about the plans and so forth, certainly you could reach out directly to Tony or individuals like that, or give us a call at the office. We're here to help you get through this. But just remember, the dates are coming up if you're making changes. Correct? I got that right.
October 15th, yes.
October 15th through December the 7th. And probably don't procrastinate, right? It'd be better to get this kind of nailed down, and then you can go into your holiday season and not have to think about that yet.
Well, yes, that's correct. You want to make sure that whatever plan you're switching to is in effect and all the paperwork was done properly.
Correct. So again, we thank you for your time. Tony, thank you again for your expertise, because you definitely have a wealth of knowledge in this area, and look forward to hearing from you again. Thank you. We appreciate it.